Hello. Yeah. Perfectly clear. Perfectly clear. How was India?
Amazing, amazing. Yeah, India for me is always this a super grounding experience for me. I'm always going back there, and I'm always realizing this idea now when my feet touch the ground of home, right?
Wow.
You feel the energy of that, right? And your body feels it, your mitochondria feels it. You feel this energy, and like the the land back there is just so mystical, you know. There's so much knowledge back there. You just keep pulling back the layers and learning more and more and more about it. So for sure, it was a grounding experience, as it usually is for me. Um, yeah, and coming back here, you feel the disconnect, right? Because such a soulful country, and then you come back where there's less community, you know, less culture. We're stuck indoors because there's no like really outlet to go outdoors, sunlight, you know,
Concrete
the
jungle.
concrete jungle, right? And it's that mentality that people are just kind of stuck inside their heads. And you come back and you feel that change, right? And it's about what I learned because I went on a pilgrimage actually,
Okay, interesting.
and it was very crazy how it all happened. But I did that, and
So
it's just
what?
like,
So because I'm Muslim, so I'm aware of my pilgrimage. So what's your pilgrimage like then?
sure. So I'm Jain. So Jainism is very similar to Buddhism in a way, but it's in the branch of Hinduism. And pilgrimage is basically it was like a 3,000 steps up to a city of temples, of Jain temples. And these Jain temples were created when our first leader was about, and they say, you know, people that attain or manage to reach the city of temples are get closer to enlightenment or freedom or liberation. So it's so actually I stayed at my Jain ashram where my guru invited us, and it was very last minute, to be honest. Didn't really know we were going to be invited to it, and it was just an incredible experience and a very purifying experience in that sense.
So how does it go then? So you do the steps to the temple. So what exactly happens?
So you do the steps, you go up, you wash yourself, you change into your prayer clothes, and then you know you go around praying. And then there's something called bhakti, which is like singing, so divine singing. Bhakti is this kind of sort of somewhat devotion to God in a form of singing. And they say that like bhakti is this one time where it gets you closest to the divine because it requires no ego, right? And we're all sitting there and you're feeling this energy. It's crazy. It's crazy energy you're feeling, and absolutely it's true because it's something that makes you feel some kind of way for sure, without any external influence, right? So what they do say, well, what my guru did say is, it doesn't matter what scriptures you know, it doesn't matter how prudent you are with your practices, whatnot. Bhakti is the one moment where you can get close to the divine without any ego or attachment to anything. And I felt that.
It sounds like mindfulness to an extent. No, is that what that kind of?
In a way, it's all a sense of mindfulness, though, isn't it? Really, because when you do embark on a journey like that, you can't be mechanical with it, right? It's all about being somewhat thoughtful and mindful about what you're doing and how like the introspection it's providing you. Otherwise,
Mm.
you know, you can do it mechanically, and you might not really understand or get the benefits or the understanding from it. But I guess you've got to be in the right mindset to understand that.
That's right. Because I can imagine if you're doing it mechanically, it could be like a timetable. I'm going to do this here, this there, this then, and it's like I can imagine it's like sounds a bit stressful, but the way that you're talking about sounds like you sound more freer as you're doing it.
Freer, yeah, freer. There's no strings to it, right? And you're going around, you know, doing what you feel like you're meant to do. You go around doing the prayers and whatnot. Um, I think you're definitely understanding why you're doing it, and I learned a lot through that too. So, learned a lot about my religion and culture,
Amazing.
and it's beautiful because you realize that we're even though you have you follow Islam and I follow Jainism or Hinduism, we're all on different paths to the same goal, right?
Yeah.
And that's the beauty of it. It doesn't matter how you get there or what you believe. Like you can't disregard any of them, and the goal is still the same, right? Spiritual, growing the spirit, getting closer to the divine, strengthening your spiritual nature, your essence, and understanding right reality and what the truth of reality is. It really reality, the physical reality. There's more to it. Yeah, it's a crazy journey.
Amazing. Is that the first time you've been?
To India, no, no. It's maybe the fourth, fifth time I've been in my
Right.
life.
But that pilgrimage that you did, you've done it before,
That was
or?
the first time I'd done it, and it just
Wow.
came really randomly and just synchronized, and you know, just came. It just happened, and you just when you realize that it was meant to be, right?
Amazing, amazing. So, Dr. J, thank you so
Mhm.
much for joining me. I
Hello.
saw your Instagram page has popped up, and I was like, wow. I've looked into holistic dentistry.
Mhm.
I really like the way you explained it in your videos, and it looked like it's quite a new page of yours, is it?
Yeah, pretty new. I guess like maybe a month and a half old. Yeah.
Brilliant, brilliant. So, for the listeners out there, if you could just let people know who you are and what is it that you do.
Cool. So I'm Dr. J, and right now I'm a biological dentist. I started more in the conventional dental route. I graduated in 2019, and I've kind of been on this whole path to leading me into the biological field. I did a couple of years in the hospital in maxillofacial surgery, which was mind blowing, to be honest. I loved it. It's a buzz working in a hospital, and then went away for a year, traveled, and I guess that's where awakenings happened, and you realize that healing can happen from within, and there's different ways to heal rather than man-made chemicals and pharmaceuticals and whatnot. And that's kind of where it kind of led me into this idea where I wanted to merge the idea of natural healing to my profession. And then you know, synchronicity popped up, something popped up, this job popped up. I sent an email in the week, and a week later I got the job, and I'm now working as a biological dentist, really. Yeah.
Wow. So, what's the difference between? Because I had a guest on who was a holistic dentist. So
Mm-hmm.
so now there's like three categories now. There's a conventional, there's a
Mm-hmm.
holistic, and there's
Mm-hmm.
biologic. So
Mm-hmm.
what is the difference between? Because you've done the conventional route, right?
Mm-hmm.
So what is the difference between all those three?
So conventional dentistry, you could say, is your typical dentistry, NHS dentistry. Kind of drill, fill the tooth, resolve the pain in the mouth, has its place for sure, and it's accessible to the most of the public. I think it's great. Then you go into holistic dentistry, and holistic dentistry and biological dentistry are essentially somewhat interchangeable terms. But I guess someone could call themselves a holistic dentist if they're being like minimally invasive, if they're using biomimetic materials for a tooth, if they're kind of incorporating nutrition and whatnot into their approach, but can be limited by where they're working, right? For example, like a biological dentist, what I'm doing is all of that stuff from an evidence-based approach more so. And I'm not limited by my surroundings because my practice is a biological practice. It's all incorporating biological practices using scientific data and evidence-based data. I guess biological dentistry maybe takes it a step further in the form of its its own sense of dentistry in a way, if that makes sense.
So if someone walked into your dentist practice,
Mhm. Mhm.
so does it look any different from a conventional one?
No, no, not really. There are subtle differences you might realize. So, for example, the small things like in the waiting room, there's a water filter. You're not just getting water from a tap or anything. Or we have an IV lounge where patients are getting high dose vitamin C, vitamin D prior to surgeries, and that's evidence based that boosts the immune system before maybe a more invasive surgical procedure. Things like this, and we use essential oils proven to just kind of calm the system. What's patient specific. For example, we use a certain essential oil after having taken an X-ray of the patient, and we ask the patient just to place it on their skin because it reduces radiation on the skin. So it's these slight subtle differences that you might feel like, okay, I'm in a holistic practice. I'm not in somewhere that's just wants me to come and get my work and leave. Here is like a wellness kind of center.
What made you get into dentistry then? Like, there's so many roles out there. Was it a parents
Mm,
thing? Because Asian parents are like, oh, you gotta be a doctor. I mean, I've never heard be a dentist, but be a doctor, be a solicitor, all the rest of
yeah,
it. So, what was your
it
story then?
is.
How did you get into it?
Yeah, it is true. My granddad was a dentist. So I guess I was conditioned from young because I would always go into his dental practice and see what he's doing. And, back then they used to give lollipops and sweets as the patient left the door. Guess it's a good business tactic, right? But I'd always be there just overwatching him. And then I was never really forced into surgery, but I think it just made sense for me. I was somewhat artistic, and yes, the parents would say that arts and those kind of things aren't going to be beneficial financially. Is that true? I don't agree. I think you should follow where your heart takes you, of course. But dentistry kind of allowed me to use my hands and my fingers for a purpose and the science base to it as well. So I think it's a mixture of all. But I think conditioning from being in my granddad's dental practice at a young age to enjoying science and art and merging the both together and thinking, all right. And of course, it's a safe career, right? It can take me around the world. Financially, I'll be comfortable. So these things, obviously, when you're picking a lifelong career, you do consider and deny that. So it just made sense in that way.
Talk to my children now,
Mhm.
and they're still really young. And instead of instead of asking them, well, what job do they want to do in future, I just ask them, what problem do you want to solve in the future?
Amazing.
I feel like that's more of a better way of doing it, because the school system, I don't know how you feel about the school system, but the school system, you're just bombarded with loads of different subjects
Hmm.
until year 11. Are you born and brought up in the UK?
One broke in the UK.
Okay,
Yeah.
cool. So you know what the system's like,
Mm.
bombarded with loads of different subjects, languages, food technology, or whatever it might be. And then I remember even till even till I was at university, I still didn't know what I wanted to do.
Mm.
And and so I'm just trying to get that into my children's head. Like, look at what problem needs to be solved. And if there is something that you like or look into doing, just speak to that person and ask that person what their job is like.
100%. 100% agree with that. I think, yeah, you're on the ball there because, yes, there is an indoctrination, right? With our kids going into this concrete school where it's time to do this lesson and this and learn this. Funnily enough, my girlfriend's sister just had a son. Her 1-year-old son were in India and we met them in Goa and he was going to kindergarten there. And you really see this 1-year-old kid playing in the forest, but putting mud in his mouth and plants in his mouth and playing with other kids. And you realize that actually, that's we're nature, right? Kids should be immersed into the idea of nature and problem solving for themselves. Like, okay, walking down this staircase, how do I do this? Or there's no regimen and 100% agree with the problem solving mindset gives the child kind of a this motor connection type thought process where they're working through a problem rather than being constrained by what they know or what they're told. Like systematically, you should think like this, then this, then this, and this, and then you get to your answer. So I absolutely agree with that. And I'm also considering ways on, my future kids and how I'll educate them in the future because I don't really entirely want them to be kind of boxed minded,
Yeah.
which is the problem really.
That's it. That's it. And I asked my daughter this morning when I dropped her off. I said to her, "Do you know what I do?" And she's like, "I don't." She's like, "I don't know." So I explained. And she's like, "Okay." I think it doesn't really mean anything to her yet, but I've been quite busy this month, well, start of the year, pretty much. So, and she sees my podcast as well. She wants to be a guest on my podcast as well. So I'm going to get her on one way or
Amazing.
another. So
Amazing.
yeah, just influencing the children is really important the right way. I wanted to ask, so you said that you were working in a hospital as well, right? You said
Yeah.
myofacial, was that what it's called? Myofacial
Ma- ma-
surgery?
maxillofacial.
Okay, what does that exactly mean then?
That is just surgery of the head and neck. So broken jaws, cancer resections, surgical extractions. So we call it a dental core trainee, and it's a role that's kind of front of house role. So you're managing like 100 things at once. Any patients coming in with maybe that's fallen on something, cut their face, closing that laceration up, broken their jaw and night out. And then you're dealing with clinic patients, a whole bunch of things.
Wow,
And
sounds intense.
intense, but it was a buzz. Loved it.
Yeah, because
Absolutely loved
you
it.
just have like patients coming in and out all the time then.
In and out. It's a 12-hour shifts, in and out. It was nonstop. It's like you're in a movie, right? You go in at 7 a.m. and your consultant's there, and it's like you got to give a whole recap of the night. What have we got in? What patients are in? And then you're going to the theater, and you're going in this, having this huddle with like the anesthetist, this specialist, right? We're going to do this, surgery and theater, and then you're going to go down to A&E, and then you're going to go down back to your clinic and do your clinic patients. It's a whole array of
Wow,
management required, and I loved
amazing.
it, but it wasn't sustainable forever for sure for me.
Oh, because of the hours or?
Hours, yeah, it's like working 12-hour night shifts, and I know nurses do that, and I know many people do that, but it's like working 12-hour night shifts, not seeing any daylight. So going when it's dark, leaving when it's dark, that has like that knock on effect, right? My nutrition was terrible. My sleep was terrible.
We're not made to be staying awake around that time. Like, I've got some friends who do night shifts, working making cars,
Mhm.
and I remember them saying in their contract when they signed up, they said, you know, the chances of you getting cancer are quite high. They said that in the
Mhm.
contract, and
Wow.
like, and how important is sleep? You know what I mean? So I'm just,
Wow.
and I did say to them maybe get some like red light glasses or something at least.
Mhm.
If you know, you can imagine the pay is good when you're working late night shifts.
Mhm.
These guys just getting like now physical problems, health problems. It's going to catch up. And they even saying to me, and
100%.
they even saying to me like, you know, we need to find something else to do. And
Yeah.
but it's like,
Yeah. Your body's the sleep is the only time where the body regenerates, right? And you're not getting that. And your whole system's just off balance. And that's of course like, yeah, feeding cancers to grow, feeding illnesses to grow. Your body's immune system is just not strong with night shifts.
exactly,
Wow.
exactly.
Yeah. So yeah. Yeah, after that I did my year away. I took a year out and I
So is
just
that where
went
you just traveled? Is it?
where I traveled, yeah, Southeast Asia, and then it was South Africa. It took me on a wild journey, basically. And I
That's
guess
amazing.
that's kind of where my true interest for biological dentistry came about because yeah, being from an Asian background, you're kind of immersed in ancient teachings, right? Ghee, haldi, turmeric,
That's it.
all
Yeah.
of these things in our foods, home cooked foods, and you don't really realize it until like my own conviction came through my own experiences. And I had this experience through a 10-day meditation retreat in South Africa where you just, I just realized we were all on this energetic playing field and I didn't want to be in this cycle and you can heal yourself. And then my Ayurvedic, I went down an Ayurvedic Panchakarma, an ancient traditional Indian medicine type thing, which heals the gut. And I experienced alopecia after my hospital work. So that kind of cured me, and that's all just through natural means, right? And I thought, wow, like the body is can be healed by itself with nature, right? And God designed us to work synergistically with nature, right? So yeah, I just realized, okay, there's got to be a way I can merge both the ideas to dentistry because dentistry is very toxic. You know, you're putting metals in the mouth, all these things that just aren't meant to be there, right?
There's tends to be a split opinion on those kind of things, and I want to get into that shortly. All
Mm,
right.
for sure, for sure.
Cool, cool. So, before we get into gum disease, because that's what I want to talk to you about,
Mhm.
how does someone who's trained to be conventional dentist eventually become and apply and become a biological dentist? Like, what's the process? Is there more exams to do? Is there another course to do, or is it just a
Mm,
case of your interest and then the biological dentistry place will just train you up to date or something?
pretty much that. Pretty much that. Unfortunately, there's no real access into this whole biological dental field, like a course or whatnot. Actually, me and my mentor, we're possibly considering creating like a course for dentists to go into to learn about this field. But I've got to live it firstly, like these this wellness field. You've got to live it because the patients that are coming in live it too. And you've got to understand this spiritual element, this holistic element to healing. And yeah, maybe right now it's difficult to find one. I was quite lucky. It just kind of manifested itself. And I found a mentor who is teaching me the way, and I found a biological practice. But yeah, there's no real access into this field. You've kind of got to live it, implement it into your conventional practice if you are, and then look out for potential roles that are more biological based and see if you can get your foot in the door with that. Conferences help a lot as well. Go to wellness conferences and
Yeah.
go and network. All these things will help.
Yeah, definitely. Because that's something I'm going to do more this year. Because I've kind of come on my shell. I think the last couple of years, I've kind of like kept myself to myself, doing the podcasting thing, kind of started gaining my confidence and then start speaking to other people.
Hmm.
And now this year's the steer is like, do you know what? Fuck it. I'm just gonna
Good.
go out there and do it. So and it's put.
Exactly why I thought as well. I wasn't used to this whole Instagram thing and recording pictures of myself. I thought, you know what? Now's the time. Just going to go for it. And it just felt right. But it comes at the right time
Yeah, there's a
when
reason for everything, right?
the reason for everything. I wasn't ready 2 years ago, but for some reason this year or last year, it just felt right. And I felt the confidence to put myself on Instagram because I'm not from a circle who do Instagram like that at all. So yeah, it just comes at the right time when it's meant to be. For sure.
That's it. Right. I want to talk to you about gum disease because how does it happen? What it is?
So gum disease and periodontal disease are again interchangeable. You can say
Okay.
gum disease is more the layman term. Patient, I tell a patient it's gum disease. I won't use periodontal. And periodontal means, the structures holding the tooth in place. So periodontal disease is disease of the structures holding in place, be that the bone, the ligament, the gums around. So interchangeable in a way. We'll say gum disease for now. Gum disease essentially starts off as something called gingivitis. And gingivitis is just localized inflammation of the gums, which can be resolved with good oral hygiene. And that's characterized by bleeding gums and inflammation, a bit of pain, redness, whatnot. And it's usually due to irritation from plaque and bacteria on the gum margin. And that's just irritating the gums, causing them to be inflamed and bleed. A chronic gingivitis leads to periodontal disease, which is more infection of the gums, more of a bacterial infection. And now you're getting into, we go down years and years worth of it chronically, you're getting down to bone destruction, you're getting down to receding gums as a result, because your bones resorb as a result, the gums follow. And that leads to, the end consequence of losing your teeth. So yeah, so essentially that they're both interchangeable things, but they have sequence of progression within both of them.
So what
If that makes
causes the plaque to form?
Well, a range of things. And biologically now we're seeing many different reasons and factors for plaque to form. So, the obvious is not brushing your teeth. Bacteria just form this biofilm on your teeth, and that sticks on your teeth. If it's not mechanically brushed off, it just grows and grows and grows, hardens to form calculus. And that stuff you can't really get off at home. You need to see your dentist to get that scaled off, or your hygienist. So yeah, it's that. But now we're seeing an array of other factors. So like gum disease might tell me there's more of a internal imbalance going on too, because you have autoimmune conditions, you have inflammatory conditions like rheumatoid arthritis, diabetes that work synergistically with your gums. If you have gut dysbiosis, that's causing dysbiosis of the microflora in your mouth too, and that's feeding the bad bacteria to grow and cause gum disease.
And is that the cause of bad breath then? Because there's some people who say that, oh, it's actually fix your gut health and your bad breath would go, because it's all stemming from somewhere. It's deep down in the gut.
Sure, sure. If you want to look further deeper into it, it can be a case. Yeah. Because if you think about it, mouth and stomach are both connected, right? And what's expressed in the mouth is expressed in the stomach. What's expressed in the stomach is also expressed in the mouth. If you have dysbiosis, bad bacteria growing in your gut, that's being expressed in the mouth. And that's kind of releasing these cytokines, these inflammatory markers that are smelly. But like periodontal disease is smelly because in a really bad case of it, it's infection, right? Pus. You get pus exudate in the gums, and that's smelly. It gives you an idea of infection in the mouth. Small things like smokers have bad breath because they got dysbiosis of the gut microflora from the smoking. So it's an array of things. Bad breath. Another thing that causes bad breath is your tongue, which is interesting, which is more of a biological thing we're covering now. If patients have a tongue tie, which means their tongue is being pulled back down in the mouth.
Yeah, so I don't know if your mentor is Seb. Is it Seb?
Yeah, yeah.
Okay, so I know on his page he's mentioned tongue tie a lot, and that was new to me because I've never ever seen anyone with a tongue tie until he showed the videos.
Mhm.
So what's that all about then? How has that happened? Like, are people born with it or what?
People born with it, kids that don't feed correctly, so bottle fed, not breastfed, they're not creating the tongue suction and the tongue isn't being used correctly. It is developmental for sure, and you are born with it, but it can develop over time with poor swallowing habits. And tongue tie essentially, most patients actually have this, which is crazy, and it's not something that's screened in a conventional screening.
But
But
why
tongue
not?
tie,
Why isn't it screened in a
just
conventional dentist?
we're just not taught to do it. We're just really not taught to do it. It's maybe out of a dentist remit, but how can it be out of a dentist remit? It's the mouth, and the tongue positioning is so important. And if you have a tongue that's not sitting in the right place, so tongue tie is being tied down to the back of the mouth, that's causing airway impediment. That's also leading to bad breath, because if you think about it, your tongue's not swallowing, moving correctly, and it's not cleansing itself. So it's being pulled down. So you get buildup of debris on your tongue, and that starts to smell.
And talking about smells, children can get bad breath at a young age as well.
Sure.
So why is that happening for? Because I can understand for adults because it's happened over a long period of time, but children are quite young. So how are they getting like bad breath?
Bad breath, it could be tongue tie. something like tongue tie. So they're not swallowing properly. They're not cleansing the top of their tongue to the palate of their mouth when they swallow. So tongue tie is one. Poor oral hygiene is another. If they're not brushing correctly, if they're eating processed sugars, carbs, that is feeding the bacteria to just grow bad bacteria in the mouth. And that's just an obvious one. And we kind of now live in this society where food is soft, right? And jaw development, tongue development is not optimal because we're not using our bones of our jaw and our tongue correctly because food just dissolves in our mouth now. And it's that kind of developmental issue we're having, our kids are having, along with feeding the bad bacteria in the microbiome just to create a absolute dysbiosis in the mouth. And it's not being seen or picked up on regularly, which is a problem.
Yeah, the most common response, like I took my daughter to the dentist. I think you saw my story, and
Mm,
they always said that just don't eat any sweets. If you do, have it with meal, and that's the most common answer I get. It's never. I mean, it's never like don't have any sweets.
mm,
But and I did ask years ago, like why don't you guys just tell them not to have any sweets? Because they're like the reality is they will have it.
absolutely. Yeah, look, we're human beings, right? And kids want to enjoy sweets. I never tell my the kids not to eat sweets unless they're in a really bad state. And I'm like, right, you just got to stop. But if you're eating sweets and snacking, try and eat it at your meal times because you're not causing a constant attack of sugar and acidity to your mouth. If you're snacking on sweets throughout the day, you're keeping it in one go, and your mouth can neutralize itself with saliva and kind of buffer itself and neutralize that acidity. And so, yeah, I never tell the kids not to stop eating sweets, but there's ways to do it, and moderation is always key for good and
Yeah,
bad things.
definitely. So, what are the steps of resolving gum disease? What are the usual steps for someone if someone's
Hmm.
got like chronic gum disease after gingivitis and it's accelerated? What can they do?
Well, see a dentist.
Yeah.
Definitely is the big one. See a dentist.
And what would they suggest? What would they suggest to do? I'm just curious, like, what is the treatment that they actually do?
So, what a dentist will do, or hygienist will do, is they'll scale the teeth under the gum line. And that's with this ultrasonic scaler that scales off all this hard calculus and plaque that's sitting under the gum line, causing destruction to it. And it's that kind of mechanical debridement of that biofilm calculus, which is allowing the gum to reseal and kind of heal itself. So they will use this ultrasonic scale, go around under the gum line and on the tooth and scale it, clean off all that biofilm and bad bacteria and calculus that's stuck on the tooth that's the main localized cause of gum disease. So essentially that's what they will do. And then hopefully they'll bring in some nutritional advice and brushing technique advice. Because if you think about it, I always tell my patients 98% of the job is theirs at home. If after I've stabilized their mouth with scaling and cleaning, and they can maintain that with good brushing, the job is done. That's the main things. So yeah, dentists will do, or hygienists will do is scale. They will clean the mouth that way.
So they'll scale it and basically clean the mouth.
Hmm.
After that, if it comes back, do they just keep doing it?
Yeah. So the risk assessment, you have a risk assessment before, and if you're high risk, they tend to want you to come back every 3 months. If maybe you're medium risk, every 6 months. If it's just a one-time thing and you feel like, okay, this patient's going to keep up with their brushing and they're motivated to do so, you could do a one-time scale and
Okay,
leave it
so
at that.
it's quite a straightforward procedure to stop this from happening. I mean, does it stop it or does this reduce the time of it getting really bad?
It reduces the microbial load, which is the real key to the inflammation, right? So it
Okay.
reduces the microbial load. Yes, there are scales of periodontal disease, and the worse the scale, the more deeper cleaning is required. And then you want to start implementing nutritional approach, supplementation approach,
Like,
things like simple things like vitamin C. Amazing. Vitamin C is lack of vitamin C causes scurvy, and
yeah.
a key symptom of scurvy was gum disease. So vitamin C is great.
So
And
do you rub it on your gums or you just consume it as you
no,
usually do?
supplement yourself with it. Good supplementation is good. Zinc is great for antioxidant, great anti-inflammatory. Magnesium, D3, omega threes. Those things, simple things, the things that people have heard of, can really fortify immune system and strengthen gum health for
Right.
sure.
So what do you think about oral probiotics? What do you think about them?
good. I do think they're good. I do think they're good. But I think getting a microbiome analysis is probably beneficial before you do that.
Is that something that you guys provide?
We are providing, yeah, yes. We look under a microscope and see what's present, what kind of bacteria is present, and inflammatory markers, and then you can tailor an approach.
Okay, that's quite cool. So it's quite functional then, basically. Yeah, you guys are, you know, actually checking how much of the supplement you actually need.
100%. 100%. You can go down the line of blindly supplementing yourself, but you know,
It works out more expensive that way. I mean, this is something that I'm actually working towards.
yeah, and that's really the key, isn't it? Because if you don't need a certain supplement, there's no need to take it.
Exactly. So it actually, if you think about the bigger picture, just guessing, just like Dr. O'Brien said in my last podcast, it's like test, don't guess, because you're actually just wasting a lot of money by just guessing.
100%. 100. If there's diagnostic tools available to really tailor the approach and they're accessible and we can use them, why not? It's the most optimal way of treating a patient for sure.
So is there things that someone with symptoms of gum disease, what can they do at home?
Okay, so what can they do at home? Symptoms of gum disease, bleeding gums, inflamed gums, smelly breath. You would kind of know if you have gum disease in a way because your gums just aren't looking right. They're just red. You know, you might get in severe cases if you have your tooth becoming wobbly, it's gum disease, most likely. Things you can do at home. Optimal brushing is number one.
So twice a day?
Twice a day, optimal brush, 2 minutes minimum. Really brush that gum line in a good circular motion throughout because you want to clean that gum tooth margin. That's where that stuff is building up and going under the gums. So you really want to clean that.
Electric brush or manual?
Either really. I recommend electric. I think electric's great. But if you've got good technique, some patients like to use manual. And with good technique, manual's absolutely fine.
What's the best technique?
Circular motions, angle towards the gum line, circular motions throughout all surfaces. Look in a mirror. Don't miss anything, especially the back teeth, because naturally accessibility is harder. We miss them. So brush those back teeth. I do recommend coconut oil pulling personally. Scientifically, evidence isn't there that it works.
So what makes you do it?
My own evidence, my own experience of it. And all my patients have incredible experience with coconut oil pulling. And it's an ancient Ayurvedic retreat. It's pulling bad bacteria without destroying the microbiome. It's supporting the good bacteria, putting the bad bacteria. Coconut oils, lubricating the gums, soothing the gums. And if you want to get unrefined cold pressed coconut oils, that's when you have linoleic acid, which is a natural anti-inflammatory. So, logically it makes sense to me. Evidence wise, there's not much out there, but there's no harm. Absolutely no harm. And you want to do it for about 10, 15 minutes, which is the only headache, really.
Yeah, I remember I need to start doing it again. I remember I was doing it for a while, but I was literally like, it was literally in my mouth while my missus getting the
Yeah.
children ready. I'm literally getting ready in the car, getting ready, put my clothes on, get to the car, and it's still in my
Uh-huh.
mouth. And then
Uh-huh.
by the time I get in the car, get that tissue, spit it out, and then throw it in.
Yeah. So exactly. You kind of want to do it when you're doing other things. You kind of want to multitask with it. 'Cause if
Not
you're
where you
just
want to have a
doing it,
conversation with your child, right?
yeah, I bet they'll find that funny though.
So you mentioned coconut pulling. What do you think about
Mhm.
tongue scraping? Because that's an Ayurvedic practice, isn't it? No?
Excellent. 100% do it.
Because I do that. I do that all the time because it's just easy. It doesn't take 10 minutes. And I got, it's actually after my first pod with Surinder Aurora, who's the holistic dentist I did a pod with last year. I think it was like 2 years ago, actually. And she mentioned it. I just got, it's not expensive. It's like probably like £1. And I got one for both my daughters. And the thing is, you can see what makes it do it even more is like their tongue is really white. So tell me about the whiteness in the tongue. What is going on there?
That's just the buildup of gunk, essentially.
Right. From what? Sugars, essentially?
Everything.
Everything.
So it builds up more overnight because you're not swallowing. And like I said before, swallowing is allowing your tongue to cleanse naturally, which is incredible because our body is just made just to work, right?
Self-sufficient.
Self-sufficient. So naturally, because our ancestors didn't have tongue scrapers, but they were eating harder foods, which was cleaning the tongue, and they were swallowing better because they didn't have these deficiencies in the jaw, and which would clean the tongue. But overnight, you're not swallowing. You have a reduced salivary flow, so less cleansing from your saliva, and it's just causing the buildup, right, of bacteria, gunk. If you're a mouth breather, even worse, drying your mouth out, causing that to build up even more. So it's just buildup of just the debris and gunk that's in the mouth, really, bacteria and stuff.
So if someone's tongue is already white and they've scraped it,
Mm,
and there's only some, I guess there's only so much you can scrape, right? Because you're gonna end up
mm,
damaging the tongue. No.
yeah,
So
for
they
sure.
scraped it. So is it a case of just constantly doing it? How many scrapes would you say? I mean, I usually do for my daughters because they're quite young. I just like 3 good scrapes and leave it at that, and just
Yeah, yeah. That is essentially leave it to your own remit, right? Because it's all logical. You're not going to over scrape and scrape too hard where you feel like your tongue's getting damaged.
yeah.
We're just naturally going to scrape 1 to 3 times till you feel your tongue's clean, gently. Don't overdo it. And that's it, really. And just maintain it as a daily habit.
Okay, so eventually, if we keep doing that, then that gunk should be disappearing. Oh, well, depending on if they're mouth breathing, right? Because if they're mouth breathing, that's gonna make it keep coming back.
There's a whole array of it. Yeah, there's a whole array of factors. Yes, it's maintaining. Doesn't mean that it doesn't stop the buildup if you have got problems.
So it's
But
better doing it than not doing it, right?
yeah, it's just like brushing your teeth. It's part of your routine, right? If you brush your teeth twice a day, in the morning you still have gunk, buildup of gunk, right? So that's why we brush our teeth in the morning. So it's just part of the morning routine. Scrape the tongue.
Okay. One thing I just can't get in my head, right?
Mm,
So when they do like testimonies or examples of African tribes, their teeth
mm,
are amazing, but they
mm,
don't brush their teeth. So what is going on there? I couldn't get my head around that. They don't brush our teeth, but in the West,
mm.
we have to brush our teeth. I can imagine it's linked to the kind of foods we're eating, yes, but like
100%.
these guys are not brushing their teeth at all. They're just like going out in
No.
the wild.
Yeah. Actually, Weston A. Price did a study of this. He went to all these African tribes, and he was wondering why in this world, yeah, are these guys just not having dental decay or issues? And in the Western world, there's so much dental decay. It's like periodontal disease is the sixth most prevalent infection, right? And decay is so rife, like most people have it. And essentially, it comes down to foods. Okay, so yes, we have lots of processed sugars, foods that melt in the mouth refined sugars, carbohydrates. That is not, our bodies aren't designed to eat that because that's kind of man-made food. It's not nature's food, and that is what's causing decay. Firstly, more pathological issues like your tongue ties. We're more mouth breathers in the West because we haven't developed properly, whereas they're eating harder foods, meats, raw foods with the raw nutrients. Hard foods is developing jaw development, allowing the jaws to grow big. So therefore, their tongue has enough space. So now their tongue's not an issue, and
And
they're
you
not
have to
mouth
chew.
breathing.
You have to chew as well, right? And something that we are just not doing. I remember trying to chew like 50 times. My God, my jaw started hurting after a while
Right.
because we're just not used to it.
Right, and we've got a TV screen in front of us while we eat, right? So we're just not being conscious of that connection, that mind-mouth connection of actually chewing and enjoying our food. We're just swallowing essentially, or we're chewing a few times, letting it sit in our mouth and swallowing it. So they don't have these things. They don't have like screens. They don't have external stuff. They're sitting around as a family. Their food is absolutely sacred to them. So they are, because it doesn't come easy, food comes super easy to us. So food is sacred to them. They're enjoying their food. They're chewing their food as a result. They're eating harder foods. These meats and greens and vegetables and fruits have raw natural ingredients. Hard foods are developing the jaw, strengthening our teeth, and they're less risk of decay because they're not refined sugars. And these harder foods are naturally kind of debriding the teeth too. So yeah, they have stronger jaws and they're more active. They're just more healthier generally. They're hunter-gatherers. They're going to eat their own food. They're going to find their food, kill the food, and it's maybe once a day. It's not a continuous, okay, breakfast, lunch, dinner, snack on this, snack on this. Okay, I'm going to go to the kitchen, snack on something now I feel hungry. They're getting the food and they're eating it once. That's it.
That makes sense. Is there any things that are what you find that people are not aware of that actually affect the mouth? Other than
Mm,
sweet sugars. I'm just curious because you mentioned that these African tribes are working for the food. It's more of a holistic kind of way of living. Is there
mhm.
anything else, do you think, or is it literally just gut health, your food, you chewing the food, and the way you sleep, mouth breathing?
Essentially it's that. I think also here in this world it's a big spiritual thing too. We're less spiritual. We're more indoors. We're not connected with nature. I think all of these things feed into good health and good mouth health. And if you're in nature, If you're with community, if you're eating good foods, your body's healthier, your gums are healthier, your teeth are healthier as a result. It's all just connected.
That's it.
So I think, yeah, in the Western world, we might maybe more, retracted from the idea of internal healing and the spiritual healing. But these African
Definitely.
tribes grow from that. That's what they really truly believe. They don't have external stimulus. They have time to introspect, and they have time for their families and whatnot. So I think those things. But yes, generally speaking, yes, the foods and what we mentioned before.
Right. Controversial topic.
Mm,
Fluoride. What's your
mm,
take on it? Because I know you did a vid and on your Instagram page.
mm,
When I went to the dentist the other day, to my daughter, and I said, "Excuse me, Mr. Dentist man, can you please, can I not have any fluoride treatment for my child?" He's fine. He said it's fine, but why? I said, "Look, it's his personal choice." I remember the lady before him, I think this was last year, and her response was fluoride in everything. Your tap water's
mm.
full of fluoride. But I said, "Well, I've got a whole house water filter system, so I don't get it in my house." So,
Yep.
yeah, I'd like to hear your view from a biological dentist point of view about fluoride because it is
Yeah.
contentious.
It is contentious, yeah. Some of my friends think I'm crazy for promoting hydroxyapatite. I think it's just so logical.
Your
So
dentist friends?
yeah, my dentist friends, and we'll get into that in a second. But simply put, it's as effective without the risks. And there's growing evidence to show that it's as effective without the risks in preventing decay, remineralizing the tooth, rebuilding the tooth. Hydroxyapatite is what the tooth is made of. So it's really compatible with your tooth, your microbiome. It's not this foreign toxin, which fluoride is, that you're inputting into your mouth. And it's the compounding effect of fluoride over years and years of use. And you're not spitting after you brush, right? We leave the toothpaste on our teeth, so you are swallowing some. It's going into your bloodstream through your gums. That has been shown to build up in your liver, kidneys, and your brain. There are links to lower child IQ levels with mothers who have high fluoride levels in their system. So, in my opinion, it's logical. Why would you take something that's a foreign toxin and has risk when you have hydroxyapatite, which is just as good and doesn't have any risk? What evidence shows you can swallow as much hydroxyapatite as you want and it has no toxicity because your body's made of it. So, like, especially for children who are likely swallowing toothpaste, I would recommend hydroxyapatite. Fluoride, those fluoride varnishes that dentist is going to put on, sure, in a high risk decayed child, it might be good and it has its place. But if it's put routinely, and why would you expose your child to high dose fluoride on their system?
What's a fluoride varnish? What's that?
That's it. That's what it is. It's just a high dose fluoride varnish and it
Oh,
protects
right.
the tooth.
Okay,
So
got
that's
you.
what you kind of told your dentist not to do. And why would you expose your child to that level of foreign agent in a way?
So
Mm.
why do they not think that it's a it's a toxic issue? Why do not? Is that because that's not their remit? That's not what their job is about looking at toxicity. They're looking at
Correct.
getting the job done.
Absolutely correct, is my belief. Yes. Conventional dentistry, conventional medicine, we're happy with the status quo, right? They're not looking towards this whole holistic idea, this whole mouth body implementation. They're kind of happy with, okay, evidence has always shown me that fluoride is good. This is what I'm going to promote. And most people don't read between the lines or do their research into these things. So it's what we've been taught, it's what's common, it's what's accessible in the shops, and it's the status quo. It's comfortable to just recommend fluoride because if the big government health agencies are saying it's safe in small amounts, then it's safe. And why? And then there's this idea of litigation in the dental field, which a lot of dentists are afraid of litigation now.
So
So
what
if
does that
they
mean for the listeners? What does that exactly mean? Litigation.
just being sued by a patient, right? I think a lot of patients feel entitled when it comes to dental work, and rightly so. And there's a high rate of suing in dentistry now, and dentists just don't want to go down that road of promoting
Um,
promoting something that's different, that could be that they don't know much about while they recommend it. But it's about being a bit of a trailblazer in that sense and sticking with your guns and reading the research and realizing, okay, hydroxyapatite is definitely more healthier for the system. Yes, fluoride in low levels is not bad, but why would you add a risk factor toxin to your
but
system?
when I spoke to Dr. Tom O'Brien, he said just generally about toxins, like it's one thing having it once, but if you're having it every single day, the compound effect is just going to
Right.
cause inflammation. And with fluoride, you mentioned it's going to be in every organ more or less, isn't it? And I've heard people mention that. I mean, I'd love to look into the studies even more so. And also, I had basically got a friend. He's just
Mm,
finished his studies to be a
right.
dentist now. He's a dentist now, and I mentioned about the fluoride thing, and he
Mm.
said, "What did he say? Is that a word?" He said, "Oh, these studies doesn't involve critical thinking." So, what do you say about that? When
They do. They do. They're look, you have to read the right study, but the studies that are reliable, have large sample sizes, are showing that hydroxyapatite is as good as fluoride for sure.
yeah,
So yes, you got to sift through the bullshit articles and literature because there's always that in everything, but there is mounting evidence that it is as good as fluoride. It's not got the amount of evidence as fluoride, sure, but that's only a case of time.
that's right. That's right. And I'm sure the more hydroxyapatite products come out, they're going to get more people. Most likely, I'd like to think so. They're going to get like evidence attached to it showing that, look, this is actually true. I mean, I did purchase, it's that green one, the green toothpaste tub.
Gutology.
Yeah, I've been using that one recently.
It's
It's
a good
just
one.
finished.
Good.
Sorry, that's a good one.
It's a good one. Yeah, yeah, yeah. It's a good one. Anything hydroxyapatite
But
based
one,
is good.
okay, but my one question that came up, and I actually
Mm,
saw a comment about it as well. It's like, how much hydroxyapatite should I be using? Because there's one thing, it's got probiotics in there, great. It's got hydroxyapatite in there, great.
mm.
But is that the right amount for me? Am I using the right amount? Or is it just a case of, look, it's got enough to brush your teeth with, and then it comes with the oral probiotics? That's something I need to like maybe supplement.
The pea size is more than enough. And it's not really a case of how much hydroxyapatite exposure you're getting in terms of volume. It's really enough to just spread over your teeth, and that's enough. So pea size amount, like you would do with any toothpaste, is enough. If it gets around all your teeth, um, and your teeth are exposed to it, then that's the amount you need, essentially.
Cool,
Yeah.
cool. Right, so I've got a quick fire round for you, so I want quick answers, all right?
All right, let's go.
Cool. Let's go. What was your first job?
Sainsbury's.
Oh, okay. Nice. Nice. So, what, stacking shelves or?
Yeah, a bit of everything. Stacking shelves, going back in the warehouse. It was during work
Wow.
experience.
Oh, wicked. Favorite holiday?
Asia, India.
All over Asia. Is that when you traveled everywhere?
Yeah, look, I think Thailand is my favorite place, but
I love
India is
Thailand.
coming close into is close there. But Thailand was the first time I had you know what, Omar? There's so many. Thailand, South Africa, and India. Or maybe three.
The diet you follow.
What the diet I follow that I feel best suits me. I don't follow any particular diet.
Okay,
I
so give
eat
me an example of what your day to day. Okay, what did you eat today then?
I haven't eaten anything yet. I don't eat breakfast. I fast. Recently I've started to actually start my mornings with apple cider vinegar, ginger, honey, and lemon. That's my tea in the morning, every morning. And then lunchtime could be anything. I'm vegetarian now. So it could be a salad bowl, could be something with, some proteins, natural proteins. It could be a organic protein shake with fruit and whatnot. And then dinner is just dinner. Indian food. I'm not overloading my system with food is number one. I'm not calorie counting, number two. I'm not checking protein levels and all of that is number three. I don't believe it suits me to do that in my lifestyle. I'm just doing how I feel great. I work out. I feel great with the food I'm having. I'm eating detoxifying food, cleansing foods, and nothing too heavy on the system. So it's
Brilliant,
my
brilliant.
diet really. I don't follow any diet.
Cool, cool. Advice you'd give to your younger self?
You as you are. I'm a lot different to what I was. Um, And that's happened through my own spiritual awakenings. And I was very external individual, but I needed to get that out of my system and have my experience where I open the doors within to really be on this path now where I feel, strong in my beliefs and I'm on the right path. So, I think I did everything as I was meant to do when I was younger and I wouldn't change that. So my advice would be just keep going as you are. I've always had a strong enemy. I've always been interested in my health. I've always surrounded myself with good people, good friends. I've always worked hard. maybe some advice would be buy Bitcoin.
Yeah, I think that'll probably be the
You
best
know, I think
advice.
that goes for all of us, right? Buy
Yeah, that's
Bitcoin.
it. That's it. That's it. That's really good advice for your younger self, 100%. Book recommendations for biological dentistry. If someone like myself or anyone who wants to start reading into this kind of thing, is there
Hmm.
a good book out there that you recommend? Because I actually absolutely love
Yeah,
books.
6 Foot Tiger, 3 Foot Cage. Good one. Um, I've actually got it here.
Oh, wicked. Let's have a look.
Oh, can you see that? No, you probably
Yeah,
can't.
if you just push it back a little bit.
There
The
we go.
yeah, oh, wicked. Nice.
And that's basically talking about how an undeveloped jaw and mouth and not enough space for the tongue is leading to a whole array of problems. Less oxygenation in the body, mouth breathing, not nasal breathing. We want to nasal breathe. That's a great place to start. It's super simple, and it opens your eyes to this world that, okay, dentistry is not just about teeth. It's about your airway. It's about your tongue. It's about your development of your jaw. It's about your microbiome. It's about how it's all linked. So that is a book I'd
Amazing.
recommend. There's
You got
another
another
book
one in
called
your head?
another one called Cure Tooth Decay. It's by Ramiel Nagel, and it's all about how actually this, which is absolutely true, which I'm seeing my patients, how you can heal tooth decay with good nutrition and oral hygiene techniques. So when I see early decay in a patient, I don't go drilling into that tooth. We go through nutrition, we go through oral hygiene, and we allow that patient to heal the tooth themselves before going into invasive tooth drilling. And if I don't believe that they're going to stick to it, then it gives me another idea to maybe do the treatment. But teeth can heal themselves if early stages.
Interesting. Tooth can heal themselves. Do you think gums can grow back, or is that it?
Gums
Is
can't
that
grow
a
back.
thing? I don't know. Or you
No,
can
gum.
reduce. Okay,
You can
that's cool.
stabilize. You can stabilize. You can strengthen. You can't reverse gum disease, chronic gum disease, severe gum disease. No.
So, scenario, you're on your
Mhm.
deathbed, you're surrounded by all your loved ones, you only have one meal to pick. What you picking?
Or dosa.
You don't have to worry if it's sweet now because you're going. You
It's
don't have
gonna
to
be
worry
it's gonna
if
be
it's
it's
sweet.
gonna be masala dosa. Masala dosa is the one for me. It's basically this
Nice and light,
Indian.
eh? My wife loves dosa.
It's great. I want dosa. I would say I just want something. I just love. I think so. Dosa is just Indian food. I love Indian food, and maybe that's my conditioning.
Top three supplements you'd recommend for healthy gums?
Zinc, vitamin C, D3, K2. They come together, D3 and K2. D3,
Sweet.
K2, K2 pulls up calcium from your blood, deposits it in your bones, strengthens your bones. D3, C, and zinc, they're all anti-inflammatory. They're all antioxidants. So they do help your teeth for sure. Probiotics too, if you want.
When it comes to the oral probiotics, are you talking about the oral ones or are you talking about the standard probiotics when you say probiotics?
Both.
Because there's two types, isn't there? Or are they both the same?
Yeah. Well, probiotics, as we said, will work synergistically with your mouth. So you want to stabilize your gut microbiome. It's going to stabilize your mouth microbiome as a result. But you can get oral probiotics too, and that works. That's less used to be.
I've seen, but where I get stuck. Okay, but so I got a two-part question to that. So, you know, what I use am I using for that? I forgot the second part now. So yeah, what I use. Oh, and yeah, and basically how much would you recommend for someone who's got gum disease?
Are we talking about gut
Because the
probiotics?
conventional dentist is not going to recommend these kind of stuff. The
No,
oral one,
see,
sorry.
the oral one, you want maybe a probiotic. What I can say is you maybe want a probiotic with a bacteria called Strep salivarius. If it has that, it's good. It initiates good healing in the mouth. I don't know really what type of dose. It's dose dependent, I guess. But with the mouth, there's no particular dose.
That's right, because you'll have to check the person, right?
Check the person, and also in the mouth, a little goes a long way. So you don't need to overdo it with high dose of anything. You just continue. It's just like toothpaste, right? You don't know exactly how much toothpaste you're putting on your toothbrush every morning, but it's the general amount, and you're doing it every day, and it's just stabilizing. So
So you mentioned the three supplements. What are the three tips for preventing gum disease?
brush your teeth, number one. Good technique, twice a day. Good minimum 2 minutes per brushing. Good nutrition. So diet's another big one. Reduce your processed carbs and refined sugars. have more leafy greens, more whole foods, more lean meats if you eat meat. And visit your dentist. Just visit your dentist. Those are the 3 tips I would give. If you want to add
Brilliant, brilliant.
mouthwash of sorts, do some coconut oil pulling 3 times a week. Don't do it every day. 3 times a week is good for 15 minutes. Use unrefined cold pressed coconut oil because that's got all the nutrients you need and that haven't been burnt off in the process of making it.
Is there any other oil that people can use? Because I remember when I first read about oil pulling, they didn't mention coconut oil. I think they mentioned linseed oil or something. I can't remember where it was.
Linseed oil's not bad, yeah, but I feel like linseed oil is this whole idea of seed oils can be inflammatory to the system, right? There's a potential for that. So coconut oil kind of reduces
Yeah.
all of that risk. I wouldn't say no to linseed oil, but with the potential of risk, coconut oil has no risk to me from what I know.
Okay, brilliant. What does health mean to you?
It's a good question. Health is feeling. And what is feeling? Such a hard thing to put your finger on what you feel. Okay, so health is whatever works for you to feel functional and optimal. It can be different for everyone. And that's not just conventional scientific methods, that's also philosophical methods too. Meditation, yoga, working on introspection, working on the mind, working on thought process, intention. I believe that aids to healing and feeling good and good health. And then supplement that with the outward body type physical thing, good nutrition. Simple, good nutrition is simple. Do things that are close to nature rather than things that are more confined to societal constructs. So get out, go for a walk more. Things like that. That's what's really healing people. Use nature. So health to me is just what works for you to feel good in the most natural way. And that's not me shitting on the conventional system, by the way. It has its place, but I'm seeing so many patients coming
Yeah.
in on their own spiritual journey and their own holistic healing journey that have healed themselves from cancers, stage 4 cancers, that have healed themselves from autoimmune conditions, all through diet, energy work, through natural healing. And it's amazing. I'm seeing more and more of this. I'm thinking, wow, like you don't want the conventional system kind of puts a plaster on you, doesn't deal with root cause. But if you get down to root cause and balance that out, you can really help heal your body from the inside out naturally. And that's what biological dentistry is really trying to do is natural healing, low inflammatory load, use more biocompatible things and do what works for your body, not what fights against your body. So healing is, health is just whatever makes you feel good in short.
Brilliant, brilliant. So what's the current plans in for yourself this year and for the future? What's going on?
Current plans, I am going on this biological dental field, this pathway, because I love this community. I'm sure you do too, right? This community of health seekers,
Love it. Absolutely
questioners.
love it. Literally keeps me awake.
It's like this community of healing and wellness seekers are we're the questioners, right? We're questioning why is this? We're seeking we're seeking to know the answer of why and how, not just being told what we're being told all our life and indoctrinated in. So I love this community and it's such a supportive community and it makes so much logical sense. So I'm going to keep just going down this path for the moment. Eventually, maybe I want to kind of create some wellness retreats or whatnot. I'm going to boost my page for awareness. That's the goal for my page at the moment is just, you know, for awareness of the biological and what is more than just dentistry. And that's my goal for the next year. And I'm definitely on this path of growing my own spiritual side too through my daily practices. And I think I truly believe in that now. I believe that we're all spiritual, right? This wellness community is all spiritual. You've got to be spiritual to realize that there's more to what reality is telling us for sure. And there's more to
We are
healing
all just
and
energy, aren't we? We are all
energy,
energy.
balancing the energy. We are all just energy, absolutely. And I've felt it, I've experienced it. I see it as like that. And once you open those doors, you can't really look back into what they say the matrix, right? Can't be go back into that. So it's kind of just following this pathway of healing people through biological dental ways and healing myself, growing my Instagram page, growing my potential business in wellness retreats is something I would like to do in the future for sure.
Yeah, that's quite interesting because 2 points before we go. The Matrix thing, I don't know about you, but I did actually try going back and it just was like my mind was like, "What are you doing? There's no way. Like with what you know already, there's something else out there to I don't know, heal these people from these diseases, or there's something big out there than just going back into the 9 to 5, going to bed, not really reading anything about what's out there, and just carrying
Mm,
on with life." That's one thing. And the second thing I was going to say was maybe there's some way the experiences that you've had in India when you went, you can bring it to the UK one way or another.
for sure, yes. But on your first point, yeah, ignorance is bliss, though, right? It's like this. Is this? You open this book, and bloody hell, it's like there's so much there, and you're realizing more things, and you're understanding more things about what's in our foods these days, and the chemicals, and all this stuff. And I do often think back to the time where was ignorant to it. And I thought, "Ah, it was a lot more straightforward." But how can you go back when you know what's right and your spirit isn't feeling right if you were to go back? Your spirit, your soul doesn't feel right if you were to go back. It's just not possible. And in the second point, definitely would like to bring Ayurveda back here. Ayurvedic is the Indian traditional healing method of, purification of the system, detoxification, and it really it's so crazy how years and years ago they created this method, and that was all through spiritual means. They didn't have science. And they say in Ayurveda, the gut is the second brain. What is everywhere online now? What is trending everywhere is gut health. And that's like two, right? Gut health wasn't spoken about like this 2 years ago, but now it's being realized that gut health is huge. And there's a lot of people waking up to this way of healing, that you can heal yourself through your gut. Mental ill issue health is connected to gut dysbiosis, to your internal dysbiosis, and it's not about taking medications to sedate you and these foreign chemicals that just totally nuke the system and throw it all off, and deals with one thing but causes dysbiosis to 10 other things in your body. So people are really waking up to that, and 100% like it's going down this line of wellness and holistic healing. I think people are more and more attuned to wanting to heal themselves naturally. So yeah, definitely want to bring that back here for sure. I'm going to do a course in that as well. That's maybe something I'll do this year, is a course in Ayurveda, so I can bring Ayurvedic healing to my patients.
Yeah, brilliant. I mean, if you're interested, I got a friend who has an Ayurvedic center in Coventry. Like, it's a proper legit. It sounds like everything that it might be the same thing that you're talking about. So, if you're interested, I could just send you their Instagram page. You can just have a look and just say, "Oh, Omar suggested me" or something.
100%. Yes, please send me that. That's cool.
Oh,